I think one of the hardest parts of recovery isn't always, like you said, physical.
Mm-hmm.
Some of my clients would say, I don't even recognize who I am.
Right.
I was driving, I was doing everything, I was golfing, and now I'm in a wheelchair.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
Welcome to another episode of Neuro Wellness Conversations. I'm Dr. Katrina Banks,
And I'm Dr. Paulette Lewis.
and this podcast is where we will have honest conversations about brain health, neurologic recovery, rehab, and what it really means to live well after a neurologic diagnosis.
Indeed,
So
we
today,
have been missing in action. We have been missing in action for a few sessions.
we have, but I'm glad that we are back.
We are back
We are
in the
back.
flesh, people.
Yes. So today's conversation is about something that we don't discuss nearly enough, and it's about how neurologic conditions change our sense of identity and what
Yes.
independence really, really means.
Yes, indeed. Yes, indeed. So I think this is an important topic in quite a few levels because we run into patients, I think, all the time that have issues with kind of defining it for themselves, and not only them, but sometimes caregivers
Mm.
um, kind of have issues with kind of defining it. When I say that, I mean they don't really feel like they have a certain level of independence, and
Mm-hmm.
the caregiver has a tendency to kind of treat them that way. So
Right.
it can cause some family dynamics. I've seen it in quite a few instances.
Oh yeah, I totally agree with you on that.
Yeah.
And I feel like you said, everybody has a little bit of a different perspective of what
Yes.
independence means.
Yep.
And it can be heartbreaking at times because most people or some people have a new normal.
Yeah.
They may never go
Absolutely.
back to being 100% independent as they were prior, you know,
Correct.
and those are tough conversations that we have as clinicians.
Very tough conversations
Mhm.
and very tough actions. I think sometimes that needs to be taken, because when we think about it, that person is not necessarily doing everything by themselves. So the caregiver has to do some things, but there are some things that they want to do on their own and probably need to be doing on their own.
Oh, yeah. That's a whole nother conversation, even with the caregivers.
Exactly.
Sometimes they're doing a bit too much for the client.
Yeah, exactly. Now, of course, when safety is an issue, you have to be mindful of that. But then you also have to be mindful of the fact that you should not try to do everything for them. There's a certain level of um, function and participation, and, like we say, independence that they need to have with certain tasks.
Mhm. Absolutely. And it's our job as clinicians to really communicate that,
Right.
because things can go really array. Like,
Yeah.
it can be really bad if we're not communicating that.
Right. Yeah. And one of the things we find ourselves doing as clinicians, I know a lot of times, is having that very uncomfortable conversation with
Mhm.
the patient and the caregiver, and sometimes both in the same room at the same time. So it can be a matter of some serious sit down.
Absolutely. Sometimes it's just their faces. I'm like, okay, take a deep breath and let me explain how this is gonna go.
Right,
Just
right.
face to say it all. I'm like, oh boy, this is gonna
Yeah,
be
we don't want any knockdown dragouts in the clinic. WWF.
oh boy. Nope, you don't need that. Mm-mm.
Yeah, but in retrospect, we have to think about it from the perspective of, okay, the caregiver has all of this burden on them,
Mm-hmm.
but I try to teach them that the reason why they're even coming to therapy a lot of times is so that they can take some of the burden off of the caregiver.
Correct.
And I think a lot of times it's hard for the caregiver to let go. It's hard for them to allow that person to participate in, their activities that matter most to them.
I agree. 100%.
Yeah.
Because most times they're grieving that person,
Yep.
like of who they used to be,
Exactly.
and then they're also frustrated because, well, some are frustrated. I can't say all, but
Yeah.
they're also
Yeah.
frustrated because now they have this burden.
Mm-hmm.
They're just taking it all in for themselves and just doing it. You know what I mean?
Absolutely. Absolutely.
So that's why those caregiver support groups are super important. And
Absolutely. That's
again, the
huge.
educational component is super important.
Right. Yeah. Yeah. That's really a really good point you bring about there.
Hmm.
Um, and I think, when we think about independence, we have to think about it from the perspective of it's not just the patient recovering from things from a physical standpoint, um, but it's a, cognitive and mental standpoint, because
Absolutely.
a lot of them are probably not comfortable with the changes that they're seeing.
Hmm.
Um, And when I say that, I mean the patients. And I know in a lot of instances, the caregivers, like you were saying, are not comfortable with the changes that they're seeing because
Mm,
they know that person for who they were. And it's hard for them to accept who they are now.
absolutely. Which can kind of segue us into the identity. When
Yeah.
identity changes, I think one of the hardest parts of recovery isn't always, like you said, physical.
Mm-hmm.
Some of my clients would say, I don't even recognize who I am.
Right.
I was driving, I was doing everything, I was golfing, and now I'm in a wheelchair.
Yeah. Yeah.
This is not what I do. Like and
Right.
they'll
Yeah.
say, I visualize me. Like last night I was asleep and I visualized me walking, and then I wake
Mhm.
up and realize I can't even do what I used to do.
It's so ironic you say that because I just today had somewhat of a conversation like that with one of my boxing participants who told me that she spoke to another patient or another class member. I'm sorry,
Mhm.
not patient, but another one of her class members who was a boxing participant and a former client of mine who notices his changes. He has Parkinson's. And so
Mm,
he's seeing the progression. And so he made mention of, in noticing these changes is kind of he's realizing that he's not really getting better.
mhm,
And so there's a conversation that I need to have with him just to
mhm,
kind of see where he is, what I can do to help, you know,
mhm,
make sure his wife and I also have a conversation. And just it kind of broke my heart a little bit because I know this person. I saw the person when he was really good, and
mhm,
I've also seen the changes. So as if I were a family member, I know the impact
mhm,
that something like that would have on me. Um, I'm just his therapist, and it has an impact on me. So I couldn't imagine what the wife is experiencing, because
Exactly.
there is questions about whether he should be driving still. um,
Mm-hmm.
there's that, whether he needs to start using an assistive device. We've had that conversation a few times, and
Mm-hmm.
of course he's not really too happy about it. But one of the other things we noticed is that his using some assistive devices actually worsens his gait. So he does better without it as of right now.
Mm-hmm.
But sometimes in his trying to, turn and make directional changes is when he'll lose his balance. So the I think he knows that his level of independence is decreasing.
Mm-hmm.
So it's starting to kind of wear on him a little bit.
Yeah, it's a tough reality.
It is. It
I see this
is.
quite often
Yeah.
with my clients, and talking to them about this new normal, and
Hmm.
what equipment they may need.
Right.
Part of
Yeah.
what we do as clinicians, like, we have to
Yeah.
let them know what may happen 3 to 6 months from now, or maybe a
Yeah.
year from now,
Right.
especially if it's a progressive
Progressive disorder.
disorder.
Yep.
Like, I think it's our duty to educate about what's going to happen next,
Yeah. Yeah.
because you don't get that in the
Right.
traditional healthcare. They're just giving you the medication. I see you in
Yep.
6 months.
Hmm.
I see you in 6 months. Here's another bout of medication. Are we going to change this? Like,
Right.
no, these families need to know, and patients need to know what to expect, how am I may be functioning 6 months from now.
Right. Yeah. And
What
they have
equipment?
questions, I'm sure.
They do. They do. And I think it's so important for us to be consulting these
Educate.
these patients on this.
Absolutely. Absolutely. I agree. I agree. I think if we were to really look at it, at what we do, especially from the neurological PT side, we
Hmm.
are probably more of a consultant than we are a therapist. And that's not to say that
I love that.
we don't do the physical things as well, but I know a lot of what I do is clinical consultation with my patients.
Hmm.
We don't get the credit for it, and
No, we don't.
they definitely don't try to pay us for it.
Hmm.
But they rely on our knowledge so much,
Hmm.
and we educate and teach and advise and instruct and everything.
Absolutely. We do a lot.
We do a lot.
We do quite a bit. And it's
Yeah.
so impactful as
Yeah.
well.
It is.
I
It
mean,
is. And I think that's what makes us stand out as clinicians, and it
mhm,
allows us to really make a difference.
absolutely. This is why I love what we do,
Yeah.
because when you see a patient's light bulb go off, and or they say, "Oh, nobody ever said that to me,"
Mhm.
I'm like, "Okay,
Yeah.
I'm doing the right thing."
Oh yeah. Yeah, that's what makes the world go around for me when it comes to what I do. Um,
Hmm.
you know, I know a lot of people, as far as therapy is concerned, it's about, seeing that patient with the hip get stronger, or the knee gets stronger, that kind of thing from the orthopedic standpoint. But I just love my neuro patients. And
Hmm.
I know for some it's a tough um side of therapy, because
Hmm.
a lot of what we do, we don't see that person go from wheelchair to running, that
Right.
kind of thing. So, but to see them go from wheelchair to standing to walking, to me is
Mhm.
like seeing, like the sports or the orthopedic therapist seeing that person go from wheelchair to running.
Absolutely.
You know,
Yes, indeed.
it's the small things, and it's the functional improvements, and the quality of life and on
Mm-hmm.
just living one day more where you can put one foot in front of the other
Absolutely. And cheerleading them along the way.
and
You know,
cheerleading them. Yep.
I think that's a big part of it. And that's
Yeah.
why when I had my clinic, I was very intentional about creating a space that was very welcoming and calm,
Mm-hmm.
that people felt like they could just breathe
Yeah.
and they could just vent while they were working. Of course, I'd make them work,
Exactly.
but they could talk about their whatever was happening, outside of the clinic and
Right.
get it out, but also work on the things you need to work on.
Work on the
You
things you
know,
need to, because that's the reason why they're coming.
absolutely.
Because they know the reputation of the results that come out of the clinic that we have. So, but part of that is because we address things like, their level of independence, like what we're talking about right now.
Right.
So, yeah, it's a whole holistic perspective, like we say all the time.
Absolutely. That's why we do what we do.
I can think of a couple other stories, honestly, with some of my other patients. Um, as a matter of fact, one of my recent patients had a stroke, and he's still very independent. Um, the affect was more from a uh, visual vestibular side.
Hmm.
Um, but you look at him, he looks perfectly fine, perfectly healthy. Looks like nothing has happened to him.
Mm-hmm.
But there's a reality of life that, okay, things have changed,
Mm-hmm.
and I am not who I was before this stroke
Yep.
that has come in. So it's a matter of kind of saying, okay, yes, life has changed, but there
Mhm.
is still life,
Absolutely.
and you still have the ability to do so much. And it's a matter of finding showing them that the glass is half full instead of
Yeah,
half empty a lot
I
of
like that.
times.
Mhm.
Yeah. And when we try to translate that they still have some semblance of independence, I think that's the perspective I try to approach
Yes,
the most with them. Yeah.
I agree with you on that. Because they'll say, "Oh, I'm not walking well." I'm like, "Remember when we literally you couldn't even hike your hip off the ground to even
Right.
take a step."
Yeah,
Like, you
exactly.
gotta go back to that point
Yep.
where you weren't even walking.
Yeah,
You
there
couldn't
you
stand
go.
up. So having to like reinforce that all the time with them, like, you've come a long way.
A long
Let's
way.
celebrate that.
Yeah, there you go. There you go. Let's pop the champagne, even though I don't drink champagne. But
Absolutely.
but yeah, just kind of letting them know, hey, listen, smell the roses.
Mm-hmm.
Because guess what? You still have the ability to, and somebody would trade places with you in a
Oh
heartbeat.
my gosh, yes. That's so true.
Yeah. I think sometimes we get into our pity parties and we forget how
Mm-hmm.
blessed we are, you
Mm-hmm.
know. So I try to, in a respectful way, be mindful
Oh yeah,
of what they've gone through, but then also help them realize, hey, listen, you're better than you think you are.
that's it.
So let's celebrate that.
100%.
Yep.
And these are conversations we have all the time.
All the time. And we'll continue to have all the time.
Absolutely. This is part
Whether
of
we are in the clinic or whether we are 100% consulting and outside of the clinic.
Mhm. Absolutely.
So we noticed that, for the most part, we we've got to tell them that a lot of times independence is not so much about doing things alone. You know,
Oh yeah.
your diagnosis may have changed your life, but it doesn't define your identity, you
Mhm.
know. and let them understand that success looks different for everybody.
That's facts.
Yeah.
I that's an explanation all the time because you'll have a let's for example a Parkinson's patient say, "Well, my friend has Parkinson's and they're doing X, Y, and Z. They're golfing," and I'm like, "Listen, you're at a different stage than your
Yeah.
friend, so you
Right.
can't compare yourself to your friend.
Yep.
We got to focus on what you need to do at this moment." You
Right.
know what I mean? Because that comes up
Exactly.
all the time. Whether it's a Parkinson's
Yeah.
patient, a stroke patient, I'm like, your stroke was in a different place, a different part of your brain than what
Yep.
your friend suffered. Your friend had a
That's
minor,
right.
and they're back to driving and doing whatever, but you had a much more major stroke, and that set you back a lot. So you can't compare
Yeah.
yourself to other people, even though you guys have similar things, neurologic
Right.
impairments, but you cannot compare yourself. I always tell my clients, don't compare yourself to other people.
Absolutely. And I think that's so common. And I guess
Very.
it's because of this. Oh, we're almost we're looking at the neighbors so much so that we're not even looking at our own, uh self, and
Mhm.
we're admiring the neighbor's garden, but meanwhile we got this beautiful garden with beautiful flowers and fruits and vegetables. The grass always looks greener on the other side, they say, and it's so true.
I was just
you
gonna say
know
that neighbor might be struggling. It may make it look nice.
Listen,
The garden might look nice,
listen.
but
And so the Bible even talks about coveting your neighbors
absolutely.
things in house, and you don't know what that neighbor went through to get what they got.
Mhm.
So we gotta understand that we've got to sometimes pat ourselves on the back and be happy with what we have and what we did. Like you said, and stop comparing
Mm.
your diagnoses with somebody
Somebody
else's.
else's.
You
Mhm.
are an individual who happens to have that diagnosis.
Mhm.
That doesn't mean your DNA is the same as that other person's. So, you know, let's let that go. Let's
Absolutely.
let it go. But I
No.
think this was a good conversation to have. I
Mhm.
think we need to continue to remind everybody about, recognizing where you are with your level of independence,
Yes.
um, and be gracious with yourself.
Yes. I 100% agree. And I want to close out with your diagnosis may change your life, but it doesn't define who you are. And independence isn't about doing everything alone. It's about
Yep.
living a life that's very meaningful to you. So I want
Couldn't agree
everybody
more.
listening to remember that.
Yep. Couldn't agree
Yeah.
more with that. I think those are wise words for us to close out with on this segment.
Yeah. So thank you for joining us for another episode of Neuro Wellness Conversations. Until next time.
Until next time, take care of that brain, and the brain will take care of you.
That's it.
Let's have a conversation about